What if I told you that testosterone isn't just for men, and it may be the key to helping with some of your menopausal symptoms? Hi, I'm Dr. Regina. I'm a double board certified psychiatrist as well as a lifestyle medicine physician. Today, we're not only mirroring the sacred with the scientific, we're also adding in lifestyle medicine. So, a lot of times people think about low T, testosterone problems, they automatically think about men. They start thinking, hey, am I having difficulties with my libido? Am I having difficulties with my sexual performance because of low testosterone? And so there are creams, lotions, potions, all kinds of things out there that are FDA approved for testosterone treatment, but it's usually with men in mind. The studies were done with men, and most people think that the solution is only for men, but not so. Did you know that testosterone is just another hormone that both men and women make? Now, women make it in much, much, much lower levels naturally than a man would make it. So an XX chromosome female is going to make testosterone a lot lower than an XY chromosome male. But once a woman enters menopause, perimenopausal, transitional menopause, whatever you want to call it, once a woman starts going through that process, it's highly likely that her testosterone, or the level of testosterone, which is already fairly low, is going to get even lower, as well as some of the other hormones. So we already know that estrogen, which is the main hormone that we think about with women, we already know that that's going to be lower. But estrogen and testosterone are very, very similar chemically, right? They're very similar chemically. And when a woman loses estrogen, she actually is also losing a little bit of testosterone, which is why a woman may not only need estrogen replacement when we think about hormone replacement therapy. I don't just think about it from a standpoint of estrogen or estradiol or even progesterone, which are normally the hormones that you're looking at when a woman is going through any change of life. We're following those hormones. I also start thinking about what testosterone is doing. Now, I know how to stay in my lane, but we do get a lot of women who are presenting to us with mood symptoms, with concentration symptoms, with energy symptoms. Guess what? Those are all symptoms that could potentially mimic depression or make a pre existing diagnosis of depression worse. So, why do I end up making this a part of my lane, right? Even if it's a side lane, well, because I'm encouraging my patients to go see their primary care doctors or whoever is predominantly caring for them, maybe their GYN or endocrinologist, to ensure that they're not only looking at estradiol, progesterone, FSH, LH, luteinizing hormone, and follicular stimulating hormone. We're not just looking at those things, but also looking at the level of testosterone to see if it could potentially be abnormally lower, even lower than it normally is. And there are quite a few folks who are in the GYN realm and the endocrinology realm, but more it's my GYN brothers and sisters, mostly sisters, who are thinking, hey, could it be that a very small dose of testosterone might do the job? And why is that? Because most people that are making the decisions about women's health aren't women. Most of the people who are at the level of the pharmaceutical companies, at the level of the FDA, they're not necessarily thinking about women's health as the forefront. So when women are getting treatments, usually estrogen or sometimes progesterone, especially if it's in the form of a cream and not just a pill, usually we're having to get those things specially compounded, right? There's not just something I can just pick off the pharmacist's shelf. I'm having to go to a pharmacist who knows how to do compounding, which is why it's always good to know someone that knows how to do the basics and not just pick a pill up and move it from one manufacturing company to the other. Anybody can do that, but it takes a true pharmacist to be able to do the compounding the way that it needs to be compounded. And women usually are going to have to pay more for these compounded medicines. However, the lowly and sometimes lowly priced testosterone is something that we do need to be thinking about because very, very low microdoses of testosterone can actually be beneficial for women who are dealing with transitional menopause. And that can help with mood, that can help with temperament, that can help with life. So please, if you know a woman, if you know a family, if you know a couple, a dyad, a husband and wife, partner dyad, that might be struggling in this area, and if you're a sister girl who has a sister friend, or a sister circle, then you might want to share with them not only the information in this video, but also some data that talks about microdosing of testosterone. There are some wonderful articles you can do. Here's the trick. You really need to go to something like Google Scholar or PubMed so that you can see the data in real time. And even if this isn't in your wheelhouse to be able to understand this information, pull the studies, because then that's something that you can send to or take to your primary care doctor or your gynecologist so that they can review it and see if it's right for you. Okay? I'm Dr. Virginia, and I hope that you have a very blessed day on purpose. Take care.